I will take roll, but through roll call, Commissioner Dorado. And Commissioner Trump.
Present.
Great. So we can move on to, I'll call the items. I'll actually read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. The second item on the agenda is the approval of the May 17, 2022 minutes.
I move to approve the minutes from May 17, 2022.
All right. I heard a second from Commissioner Dorado. Sorry, there's a lot of feedback. Let's see. There's no one on the public comment line, so I can take the motions as an action, and we can move on to item 3, which is the DPH Behavioral Health Services Internship Pipeline update. And I'm going to pull up the presentation. And Ryan, would you introduce yourself, please?
Great. Yes. Hi, everyone. My name is Ryan Fuimaono, and I am the BHS Internship Coordinator. Next month, I'll have been in this role for a year. And I think it was almost a year ago that our director, Jessica Brown, joined you all at this meeting to give you an update about the programs at that time. So very happy to be here in her stead to give another update on the work that I've done over this past year. Like I said, my name is Ryan Fuimaono. My pronouns are he, him. I want to share just a little bit about myself. I live in the Mission with my husband and 2 cat children, and I am a proud Samoan with roots from the village of A'olo'ao on Kukuila, American Samoa. I am a licensed clinical social worker. I was born and raised in San Diego, but I've called San Francisco my home for the past 20 years, 10 of which I've worked for the Department of Public Health. I got my social service start back in the nonprofit world at San Francisco Community Health Center, formerly known as API Wellness Center, which is where I first met Commissioner Chung, who was on the board at the time. So it's very nice to be here with you again. I'm glad that our paths continue to cross. From there, I went on to get my MSW at Berkeley, and while studying there, I interned with the Department of Public Health at 2 of our community programs for youth. So being here today as the internship coordinator for BHS really feels like a full circle moment for me, having experienced the ins and outs of our system, first as a consumer, then a trainee, to being a clinician and clinical supervisor, and now in this more administrative role. So again, really happy to be in this virtual space with you all to share about my work over the past year. And what else did I want to say before we get into the slides? Oh, just to name something that you'll see on this first slide, our name change. So formerly the Office of Equity Work and Workforce Development, in the spring, we underwent a voting process and came up with our new name, the Department of Justice, Equity, Diversity, and Inclusion, AKA JEDI. And I think the thought here was to really, it rolls off the tongue, was to really just capture the guiding values of our work. So that's our new name. Next slide, please. I wanted to just ground us again in the goals of the 5-year Workforce Development Strategic Plan, which has really served as guiding principles for my work with the JEDI team. And those goals that you can read here: transform our workforce to better reflect our service populations, to ensure that our workforce has the training, skills, and tools to deliver high quality responsive care, to support and empower staff to be engaged at work and grow professionally within BHS, and to incorporate peers across all levels of the workforce. to share that last week I was in on a stakeholder meeting for the California Behavioral Health Directors Association, in which they shared draft findings from a workforce needs assessment that they've conducted on the state level. And I was both reassured and a little worried to learn that so many of the workforce shortage issues that we're experiencing here in San Francisco are being felt across counties all over the state to varying degrees. And the very clear message that I took away from that is that we need to hold the same sense of urgency around addressing our workforce issues as we did when pivoting to telehealth in the pandemic. And so I'm really excited and grateful to be lending my work and energy towards these issues in my capacity as internship coordinator. Next slide, please. So this slide just kind of gives a broad overview of our work the last year compared to year 2020, 2021, as well as a look ahead into the next academic year. So starting from that top row, you'll notice that last year, 2021 to 2022, we had a slight dip in the number of civil service interns that we hosted. And this, of course, has everything to do with the pandemic. Um, and even that number 7 from the 2020 to 2021 was a decrease from the previous year. But as you'll see, looking ahead to 2022, 2023, we are expecting a near 400% increase in the number of interns that are going to be joining our civil service programs. We're onboarding 15 students, and I fully expect this number to continue to this growth to continue to be the trend as we focus as a department on filling vacancies across programs, which means more people to supervise interns. So things are looking up. That next row highlights some of the newer partnerships that we've entered into with different academic institutions. Um, and I just want to pause to speak a little bit about some of the lessons I've learned around our MOU process. Setting up an MOU with an academic institution is a really time-intensive process that requires a lot of coordination between the school, sometimes the students, myself, and our contract department, as well as the city attorney's office. And the way our system is set up, we're pretty rigid around our templated contract agreement that we want schools to sign off on. And what I've learned is that when we encounter similarly rigid academic institutions, sometimes these MOUs don't work out. And so we had a lot of starting to talk about these contract negotiations, but then it didn't work out with some schools, such as the University of Oklahoma. There was an online MSW program that it just we couldn't come to a mutual agreement, and I think Pepperdine might have been another one. So just wanted to share some of that lessons learned around our MOU process. Um, and then the last row gives some information about how many students we've been able to award with stipends through our multicultural student stipend program. Um, I'm really happy to share that we've increased this budget significantly for this next year, which means that we'll continue to be able to support students financially, even as our numbers grow. Um, yeah. So, broad overview of the last year. Next slide, please. Um, so, last year, highlights continued. So this last year, I led a weekly didactic learning series for our civil service interns. This group brought in trainers both internally within the department as well as external trainers to support the students' learnings around a range of clinical topics like strengths-based assessment module that we did in partnership with the California Institute on Behavioral Health Services, engaging BIPOC communities through telehealth, dialectical behavioral therapy, just to name a few of the topics. And really, and going back to that second goal of the strategic workforce plan, just really ensuring that our workforce, or in this case, future workforce, has the skills that they need to be able to provide high quality and culturally responsive care in the public behavioral health realm. So that was the didactic learning series. We also increased the number of civil service placements available for potential placement. And so we had 13 civil service BHS programs that folks could apply to be placed at. We also launched our new website, which I'll share about at a future slide. We continue to work with HR to try to centralize onboarding processes to make it less work for the site supervisors when they're recruiting and onboarding interns. And we planted the seeds for future bachelor level placements in our system. One of the highlights there is that Chinatown North Beach mental health clinic became a placement site for the community mental health certificate program at City College, because they're really trying to invest in future Chinese and other Asian language speaking health workers. And so we're really glad to make that partnership happen, and they're going to be onboarding 2 of those students next month. Let me see if I have anything else looking at my notes to say about that slide. Oh, just to say that we also had hosted an undergraduate student from San Francisco State through their Willie Brown Fellowship, who worked on developing outreach materials to one of our Black African American innovation projects out of South of Market Mental Health. And I think that's it for this slide. Next slide, please. Okay, so we're going to get into the old website and the new website. So for folks that were familiar with the old website, this is what it used to look like. And you'll see that it's very text heavy. And when you clicked on placement opportunities, it opened up a PDF of a document that you see on the right side there. And these documents needed to be constantly updated. Just very text heavy, not super easy to navigate. And so I really wanted to revamp this website to make it more kind of intuitive and more streamlined information. So you can go ahead to the next slide, please. This is the after, and I really base a lot of the information on the old website, but kind of like edited the information to have it be more streamlined using the new SF.gov, and you can see the actual website there, the new SF.gov format. What else to say about this? What's great about the new SF.gov format is that information can be updated in real time and instantly translated into Chinese, Tagalog, and Spanish. And the website can be viewed really easily on a phone or other non-computer device like an iPad. And you're not having to like do all this zooming in. It just like looks really nice on other devices. Next slide, please. So here is another view of the website, kind of like scrolling down the page if you were actually visiting the website. You'll see that all of the civil service programs that were in the hosting interns on the left, as well as some of our community partner agency placement opportunities on the right. Just to note that these screenshots were actually taken back in May. So if you look at the website now, it may look a little bit different, but this was just to give you an idea of the layout. But I think I want to speak to who those interns are and who the programs are that are hosting interns. And so, and I'm going in kind of like random order than what the slide shows here, so bear with me. But like I said, Chinatown North Beach, they're hosting those 2 community mental health worker certificate City College students, as well as 1 MSW student from Berkeley, 1 MA/MFT track student from State, San Francisco State, and also one MFT student from CIIS. All of those interns are bilingual in at least one other Asian language. They received a lot of interest, and I'm really glad for them because they had really strongly expressed to me their desire to invest in bilingual Asian-speaking future clinicians. So I'm glad that they received the interest that they did. Another clinic that it came back online after taking pandemic-related hiatus for a few years is Omi Family Center. They are one of the two civil service psychology placement sites, and they're going to be hosting two PsyD students from the University of San Francisco. And then another clinic that is back after taking hiatus due to the pandemic is Southeast Child and Family Therapy Center. They're going to be hosting two MSW students from state. And then there were a bunch of new placement sites. And those included Family Mosaic Project, that's going to be hosting an MSW student from Berkeley. Gender Health SF is going to be hosting a student for the first time, an MSW student from San Francisco State. The South Van Ness Adult Behavioral Health, HIV, and Gender team is going to be hosting two MFT students from USF. Foster Care Mental Health was the other psychology placement site. They're going to be hosting two students, one from the Wright Institute and one from Alliant University. And last kind of new placement was the Bridges Engagement Services team, which is one of the new programs out of the Office of Coordinated Care through the Mental Health SF initiatives. They're going to be hosting an MSW student from state as well. And then there are two placement sites that had hosted students throughout the pandemic and will continue to do so into next year. And those are Chinatown Child Development Center, CCDC, that's going to be hosting one MSW from UC Berkeley and one MFT from State, and Jail Health, which is going to be hosting two MFT students from USF. And then these other programs are not on this slide, of course, but there are a number of programs that continue to be on, their internship programs continue to be on hold until they're able to stabilize with staffing and feel like they're in a place where they're ready to support students' learning. And those are clinics like Comprehensive Crisis, who hosted a student last year but are deciding to pause as they undergo a lot of changes around their hours and everything. Mission Mental Health, Mission Family Center, and Families Rising. Those are all clinics that are continue to be on pause, but maybe after next year. Okay, next slide, please. So my priorities into the next year are that I want to continue to support our programs and supervisors to enhance their capacity to take on students. This looks like taking on a lot of the onboarding / administrative tasks associated with onboarding interns, like ensuring background checks and health clearances get done. This work is incredibly time consuming and was named by several sites as a barrier to hosting interns. So I'm happy to support them in this way now that I'm in this role full time. It also looks like hosting regular convenings of site supervisors to make sure that we are staying on top of issues that are coming up and just being really good about communicating across programs. And I'll also be leading a monthly consultation group for newer intern supervisors that's starting next month. I also want to continue to partner with HR to streamline recruitment and onboarding processes. And I want to say that myself and a few of my team members on the JEDI team meet regularly with representatives from DHR to see how we can better collaborate around issues of recruitment. And one of the things that I'd like to see us do better at is around data collection of our interns to understand who are those folks that we are investing and training, and how many of those make it into our workforce, and how does this support or not our department's equity goals. We know that many of our interns make it to our workforce, but we haven't been really good about uh, keeping this data. It's all just kind of anecdotally of like, oh yeah, I used to be an intern, even like my story. So I just want to make sure that we are being thoughtful about keeping that data, and yeah, and how can that inform future recruitment efforts and all the things. But we gotta know what we have before we, anyways. Um, I want to continue to build out the website. So yeah, I have a lot of ideas about how to make the website better. And the great thing about the SF Gov format is that it allows for a lot of functionality that we didn't have before. So I have this vision of it being like a landing site for all of the different levels of internship, and then with like thumbnail buttons that would then take you to a sub page for like graduate clinical level versus undergraduate versus high school versus peer internships, kind of all feeding out of that one website. Um, I want to continue to explore and and build, create new relationships with academic institutions, and that was the other thing, partnering with HR to see like who who are those schools that are serving the most people of color that we want to see enter into our workforce, and how can we target recruitment efforts with those schools. Um, and what's the next one here? Explore additional opportunities for stipends and scholarships. Um, this last year, I also took a lead role in the upcoming San Francisco County loan repayment program that is largely funding from the state with a percentage of matching funds from the city and county. Um, this loan repayment program will award licensed direct service providers across our system of care, so not just limited to civil service, but also partner agencies, with up to $10,000 towards student loans. But there's an opportunity here to leverage some of these workforce funds towards stipends and scholarships in addition to loan repayments. So I want to see how we can like financially incentivize interns joining our system beyond the MSSP program that we have going. Um, and lastly, not lastly, but I want to establish placement opportunities for Faces to the Future. This is our high school program that operates out of John O'Connell High School. And last year, we had to creatively pivot in response to the pandemic. And instead of having the students come in to programs in person, we led a series of virtual career panels where they got to meet civil service employees that are working in behavioral health and kind of hear their stories. But as we kind of re-emerge from the pandemic, we'll be definitely looking at reinstating in-person placements for those high schoolers. And lastly, to update our policy around internships, um, and specifically to include guidance around employment-based placements, which we're seeing more demand for. And we really see this as an equity issue, wanting to be able to support folks that are already working within our system when they go back to school and want to advance in their careers, and are looking for internship opportunities where they work. So I want to incorporate language around that into our existing policy that would bring us up to date with newly released guidance from the Council on Social Work Education Commission, around employment-based internship placements. Next slide, please. And that's it. Any questions?
Thank you, Ryan. Commissioner Gerardo, I apologize. I still have COVID brain, and I got your questions and submitted some of them, but forgot to cut and paste it to Ryan. So Ryan, I'm going to read off some questions that Commissioner Gerardo sent. I'll read them off, and then I'll remind you in case it's hard to go back and do them all. One is on slide 4. Please explain seeds planted for future behavior of bachelor level placements.
I think what I was thinking with this was the community mental health certificate placement at Chinatown North Beach, specifically. But also, we've received, I wouldn't say a lot, but definitely some inquiries from bachelor level students that are looking for placements in our system. And I want to be able to accommodate those kinds of requests and build structure around more undergraduate placement opportunities. I say seeds planted because I think it's going to be, we need to go slow and be intentional about it because, our programs are still recovering from deployments and ongoing vacancies and all the things. And so it's definitely something I'm talking about with program supervisors. Um, Planting the seeds. I think there's interest in the system, but I just don't know where it's going to be right now. But the community mental health worker certificate was a clear, like, okay, we're making some progress towards that. But definitely more info to come.
Thank you. So you just expanded a little bit on your faces to the future explanation, but I'm going to read her question because I don't know if you hit all the things she hit upon. So on slide 8, I think this is it. What are the current opportunities for peers, undergrads, and high school students? What programs listed will focus on this possible internship group for Faces to the Future?
Yeah. So at TBD. Yeah, because last year we did the virtual career panels, and it felt like a good way to one of them was actually in person. It felt like a good way to continue that program and to still be like, hey, we're here and we want you all to come into our system and gain experience in behavioral health field. And we don't know how that's going to look as we enter into this next year. So yeah, I don't know that I can speak to that really clearly right now.
Thank you. And then this is a comment on the information to apply on the website. When you click on schools affiliated, the link goes to ZSFG Learning, not the actual schools affiliated. So that's an FYI to you that maybe there's it needs to be relinked or reconnected in a better way.
Okay, thank you. Because we just got a new list from our contracts department of the current MOU, and it's on my list of things to do. So hopefully by tomorrow or in 2 days, I will have uploaded the new current list of schools.
Great, thank you, and thank you for that. And Commissioner Dorado, I saw your hand, and I'm gonna put you on speakerphone so you can talk. Commissioner, could you mute your computer so that when you talk, we're not hearing the back.
Okay, can you hear me?
Better.
Okay, thank you.
Sorry, hold on. Oh, did I cut it off? Hold on, Commissioner. We have to talk again.
Okay.
Okay, try again. Hold on. I'm gonna turn all the way up. Okay, go ahead.
This is excellent. I've gone on the website and it's easy to use. You've done a great job. And I really appreciate your work and your vision. And it sent a number to the website to apply. So kudos to you. Thank you.
Thank you very much.
Great. Thank you, Commissioner. Ryan, did you hear all of that? Did you get it all?
I've heard, yeah.
Kisha Dorado is a psychologist, and she said, she gave you kudos, but also said that she sent some folks to apply, and that she's very impressed and happy with the work you've done. I think I'm paraphrasing, but just for you to know. Commissioner Chung, any questions?
Thank you so much.
Oh, sure. I see your hand, Commissioner.
Yes, thank you. And thank you, Ryan. I really appreciate how you come into these presentations and also, like introduce yourself. It makes us all feels like we know you a little bit better. And also the way that, like your vision is really clear to come through. And I'm really excited to see once this, like the whole COVID things comes to an end, then, everything gets back to, like gets back on track, like what the program is going to produce, how many new Ryans are we going to have like at DPH, and especially in behavioral health. So one of the things that I'm curious about is because you have these different levels of internship, what do you think is the objectives, like to engage high school interns?
Like for high schoolers specifically. Oh gosh, I don't know. I don't know. I know what I know from my experience at the Faces panel, because I participated in that, is that our poor high schoolers have really been through it, and academically may be at a certain grade, but developmentally and socially they are the grade that they were before the pandemic started, and just like being used to sitting in a classroom and asking permission to go to the bathroom before you just get up and go, just all of these things that the youth need to be like re-socialized to do. And at the same time, because there's so much attention to mental health amongst our youth, and you see this on like TikTok and social media, everything, the kids really see this as an important issue, that they don't really have that stigma around behavioral health as they did maybe 10, 20 years ago. I see there's a lot of opportunity to tap into that, and just like I said in the slide, plant the seeds for future careers in behavioral health. Um, I don't know. I think the challenge is, though, to be really honest, is that I want I want having a placement site at a clinic to not be seen as extra work by the clinics, and so I want to be able to support whoever's going to be their go-to supervisor um, at the clinics, so that they're feeling like, oh my gosh, I'm investing in this future workforce, and this is also helping me, and it's not just like another task that they have to do. So I see it like, yes, creating the placement sites, but really supporting the workers that are there to provide that best learning experience for the youth, and tapping into all this potential that's there with the youth that are so curious and don't have that stigma around mental health. Um, but yeah, I don't know how that's going to look.
Yeah, so the reason why I ask is, a lot of times, when people talk about high school internship, it's about them sitting in the office and do nothing. So I
Yeah.
don't think that that's the kind of internship you want to get out of this. Knowing you for so long and knowing your enthusiasm in everything that you do, like I have faith that it's going to be a brilliant program.
Well, thank you. I hope so. And I look forward to coming back and giving y'all more updates and being like, look
We
what
look
we did.
forward to that too.
Thank you so much, Ryan. Commissioner Dorado, is it okay to move on just in terms of time? All right, great. And I will work with Ryan to schedule an update maybe early in the new year or something. So we've got like 8 months to maybe, get a little bit more work done, but not too long, so that y'all are on top of everything. All right, so we can move on to item 4, which is the jail health services update, system of care for incarcerated people. Dr. Lisa Pratt. And Dr. Pratt, I gave you permission to share, but again, if you have any trouble, I'm happy to take it over.
Actually, would you mind advancing the slides that I sent, Mark, and then that way I can see my notes at the same time.
Sure, give me a second to change over to that.
Good afternoon, everyone. Thank you for inviting me and for the opportunity to talk about this, maybe a little bit of certainly an iterative, if not aspirational title to this conversation about, really, this is about flow and how people move in and out of the jail and where they go. I know it's a big bucket of mystery. To everyone, and unfortunately, a little bit mysterious to us too. So I want to start with this with sort of dip a toe. I am Lisa Pratt. I'm the director of jail health. My pronouns are she, her. I've been here since 2016, and I am thrilled to talk about this at a time when behavioral health services in the department is as robust as I've ever seen. And we have amazing leadership. And this is the kind of connection that we need for people who are coming out of jail. Mark, can you, I don't, it looks weird on my thing, but I don't know if you've got the full screen. Thank you. So just an outline, and of course, thanks to Mark and Dr. Hammer for contributions and comments to this slide deck. We'll just start off with a review of what was really a seminal moment in jail health and care of incarcerated people in San Francisco. We'll review who's in the jail right now, and then sort of how you get into jail, and then how you get out, and what we hope to do better to improve that with some opportunities coming up. Next slide, please. Just to remind you an overview of where jail health sits, we are in the ambulatory care section, thank you, of the San Francisco Health Network. And I, of course, work under the leadership of Dr. Hammer. Next slide, please. And just to review the important message of the Health Commission resolution that you passed in 2019 about the role of public health in preventing criminal justice involvement, and to really look at the social, economic, and environmental detriments of health that predict criminal justice involvement, and acknowledge, recognize, and mitigate the criminalization of race, homelessness, and poverty, in addition to substance use disorders and mental illness that lead to incarceration. This is why this is our lane. As people say, this is our work, and why it's both really groundbreaking and revolutionary that our Department of Public Health sees its role as caring for and preventing incarceration in our city and county, which is unusual. Next slide, please. Just a reminder, reacquaint you with my staff and who we have working in the jail. We have 154 FTEs. Almost all of those are clinically active people, professionals working in the jail. We have medical care with providers and nursing. We have behavioral health department under the direction of the Deputy Director of Jail Health, Tanya Mera. We have our HIVISN prevention division. We have dentistry, pharmacy. And I want to focus today on really the work of the nurses and behavioral health, because they're primarily the people working to secure a transition for people leaving the jail. We have 56 RNs, FTEs. We have about 46 positions currently filled. And just to level set a little bit, with our current population of almost 800, that's when people are trying to understand kind of the care that's provided in the jail, I liken it to a long-term care facility. So we're most like Laguna in our system. We have to provide medication to people in their rooms, which in this case is in their cells. We rely on nursing to see and evaluate anyone with a medical complaint because people can't leave their cell to make it known that they have a problem. This all has to be done where they live in the housing unit, much like it is in Laguna, although in the neighborhoods, people are out during the day, and that's not the case in a jail. And I believe the last time I heard a presentation from Laguna, they said they had 1,000 RNs. So same size population. Obviously, we don't have people who are total care. We do have people with mobility issues, but we have a healthier population. And then we have really the work of behavioral health involves identifying people who have or are at risk for mental illness and suicide in the jail the first thing when they walk through the door, stabilizing those patients in those circumstances who are either experiencing or at risk, and providing, full scope care for them in that way. And then we have a small team that is dedicated, very small team that's dedicated to transitioning people out of jail, and that's the amount of work they do is remarkable and insufficient for the needs of people exiting the jail. So fortunately, we have many community partners, but we have had a big impact with COVID on how those workflows operate currently, and I'll talk a little bit more about that. So just to review, oh, sorry, Mark, can you, next slide? I'm advancing my slides, but so to look at the going up to 2021, we see a big reduction in the jail population between 2020 and 2021. And this was the decarceration related to COVID and the closing of County Jail 4. As you recall, there were County Jail 1, County Jail 2, County Jail 4, and County Jail 5 were the facilities, the 4 facilities in San Francisco and San Bruno. County Jail 4, which was the seismically unsafe jail above the Hall of Justice at 850, closed in September of 2020, and resulting in a reduction of 1/4 total beds that the sheriff operates in the jails. Coincident to that, we had the beginnings of the COVID pandemic and a move quickly to move people out of congregate settings like the jail to protect their health. Again, another public health issue. And I don't have data for the full year for this fiscal year of 21-22 because of our Epic transition. So we started with Epic in October 2nd, and I can tell you that it looks like the population is about 10,000 incarcerations based on the first 2 quarters of the Epic data that we have. So we're projected to have about 10,000 for this past fiscal year that just ended, with about the same number of total unique patients. We have had significant stability year over year in the demographic data, looking at the share of men, women, and genderqueer, transgender, non-binary, if that's the pie chart. And I don't expect that will be any different. What I do have, we had 55 genderqueer identifying people in 2021, which was less than 1%. And you can kind of see the tiny little pie slice there. And what I do have to share is on the next slide, Mark, and this is data, snapshot data. So this is the way the Sheriff's Department likes to report data. Historically, they say who's in jail on any random day. So they chose April 19th, 2022 to look at who's there, how long they've been there, what are their charges, things like that. So this is data from the Sheriff's Department, and the stability and the race ethnicity is remarkable. Despite the decarceration and the drop in population, we still remain with a overwhelming number of Black African Americans incarcerated in our jail. In our city of 6%, Black African Americans, 5 or 6%, and the stability of the large Latino population as well. The difference between the booking data, which is incarcerations on the previous slide, and this pie chart can be explained by the fact that while women are arrested at this rate and brought into the jail at 17% of the total, they don't stay as long. Women typically have nonviolent charges, and so they do not stay in the jail, so they're likely to not be represented at the same number. And again, you see, although there is no tiny slice here for genderqueer, transgender, non-binary people, there were 11 on this day. And then you can see the age at booking as presented. And on the next slide, it gives us information about where the residency of the people who are arrested. This heat map demonstrates what we've long known about communities impacted: Tenderloin, South of Market, Bayview, Mission, disproportionately. I don't know that that's any news. I think the news about it is that it's not changed over decades. And the other thing I want to point out is the unsheltered transient number, and this is again from the Sheriff's Department at 35%. Now, this does not represent people who lose housing as a consequence of incarceration, or those who don't have a permanent residence, because that's not, these are really people who are living on the street when they're arrested, so the unsheltered transient. The other important thing to note here is the out of county, 17% of people out of county, which makes information about homelessness difficult to obtain. We also rely on CCMS data, but that does not follow anybody who does not live in San Francisco in terms of accessing homeless services. So we know that this 35% is indeed an undercount of people who need shelter when they leave the jail. So just to kind of frame where we are. And next slide, please, Mark. Now I want to kind of briefly go through what is a very complicated and in some ways very unpleasant process to really grasp, and it is the mashugana of our criminal justice system. And this is a super simplified graphic, and still it's too busy. The stars, the green boxes are exit points from the jail, from incarceration. The stars are also places where people leave at points during this flow from the jail. And the thing I want to emphasize about this is people can leave at any of these points, and we in jail health do not have any idea that they're leaving or even that they're gone, except they disappear from the medical record after sort of 2 or 3 updates from the sheriff's management system. So, for example, the first star, someone's booked into jail and they have a citation, so they're cited out. So they may be in jail for 6 hours and then they leave. They don't need to do anything about appearing in court or anything before they go. And those citations are often things like people who are using drugs on the street, or sit-lie law, the sit-lie law where the cops can bring people in, but they're going to be cited out. So those people get little to nothing. This is almost like left without being seen in the ER. You know, that's a metric that the ERs track. That's a little bit like left without being seen. So those folks are here brief time. They are almost untouched by any kind of exit service that we provide or the sheriff provides or adult probation or any of the other agencies. Then they go to court. Then they may, we've just been through a system of no bail, no cash bail. The new DA has committed to reinstituting bail, so that may change the situation about whether someone stays in jail just based on the fact that they're poor. And then we go through all these pretrial activities, and there is a lot of work at this point that goes into from 72 hours to weeks or months that's happening behind the scenes. Again, it can turn into pleas, acquittals, or the person can go to trial. And all of this back and forth is between the DA and the public defender at this point. And we are very blind to what's going on in the court at this time with a patient who's in jail. Next slide. Then this is the easiest part, because once the sentencing happens, either there's a plea, and even then with the plea, we don't have a time frame of when someone's going to be released from jail unless we're specifically contacted by the public defender. If they're sentenced and sentenced to either probation, state prison, or jail, we do have information about that, because those things sort of unfold in a slower way with a lot of notification. However, when someone's sentenced to state prison, that is their next stop, and there is nothing that we have to do to get them ready for living outside of the carceral setting, because they're staying in a carceral setting. Same with jail. And if they're on probation, then there is work to be done, and we do that typically in coordination with adult probation. So that's a quick and dirty overview of what happens. The other place where it can stop after adjudication of any of these or plea bargainings, is then before someone's released, the sheriff's department will look for any out-of-county warrants or holds. So a plea is made, an agreement, the person is going to leave jail on this day, but then the sheriff's department will see that somebody has an out-of-county warrant that requires them to appear in Shasta County. And Shasta County is notified. They have 3 days to come down and get the person and bring them to Shasta County to appear for their warrant. They may or may not do that, but that also changes the movement when someone is leaving jail. And that's a very complicated piece to it. We have very little information about this process. Mark, next slide, please. I just want to point out, Cal Matters published a really illuminating report about wait times in jails and what happens and why people end up staying in jail for years. Jails are meant to hold people while they go through the process of adjudication, and typically that's about 2 years or less. That was the idea. But we have people in our jail. There are people in jails all over the state of California who've been there for 5, 8, 10 or more years. And that's really like being in limbo. When you go to state prison and you start your prison sentence, you live in prison town, you work, you go to school, you have health care from your primary care physician, you see your primary therapist. I don't want to make it sound like it's a nice place. It's not. Prison is not nice. But what's worse is being in this sort of purgatory state where people who are awaiting adjudication are, and including San Francisco, where the sheriff's department is currently defending litigation about the fact that nobody in San Francisco who's in the jail gets to go outside. They have no outside time. And this is a well-protected right for state prisoners, but there is no outside in San Francisco jail. So if you're in jail for 5 years, 8 years, the only time you've gone outside is when you go to the hospital to get health care or when you're transferred from San Bruno downtown to court. So just to identify, in part, people decompensate in this circumstance. And it is, as I mentioned here, the overwhelming majority of people in our jail are not sentenced. They're waiting for adjudication. They're in this limbo. And delay is a legal strategy that the public defenders use to ensure that their clients, are not going to end up with state prison sentences. Now, the other thing that's happened with COVID is it's exacerbated this because the courts were closed and they're still operating, anything that required a jury trial, the juries come together and they're sitting in a congregate setting. I mean, this has made this problem, which has been a big problem, even worse. And for those of you interested, I'm happy to provide that link because this does not serve our patients. This does not make anybody with mental illness better, and it doesn't make anyone who doesn't have mental illness less likely to develop mental illness. This is really a catastrophic circumstance that is occurring in jails everywhere, but it's occurring in our jail, and that's what we're responsible for. Next slide, Mark, if you would. And this is just a snapshot for those people who were in jail on April 19th, who's been here for a while and what that looks like. And we see that there is this outlier population. It's not big, but what is particularly disheartening about this is 50% of the people in custody a year or longer are Black African American. So you see the number of arrests, around 35% Black African American, 44%, 40% sort of stay in jail, 44% on any given day in jail. And then if you look at time, so this is a disproportionate amount of time for Black African Americans in jail. And another way that the structural racism is sort of embedded in incarceration. Okay, next slide. Okay, so here's the thing: whenever you apologize for a busy slide, then the teaching is don't use it. But what I want to show is just how complicated it is for people who are trying to transition to residential treatment behind the scenes. This process is very much in transition, and this slide represents before times. So these time frames have mostly only gotten longer related to COVID due to restricted access to the jail. So you see many of these places have people coming in from outside, from Health Right 360, from Progress Foundation, from Baker to do an assessment of the patient and find out what their sort of right treatment setting would be for that person. That was very much restricted at the beginning, the first 2 years of the pandemic, because having people coming from all over everywhere else into the jail only heightened the risk of bringing COVID into a very vulnerable setting with vulnerable population. So the good news is that the department has opened more beds and added more beds to this process that are not represented here. But I just wanted to show that, there is the reentry staff, my staff, doing this work. There's also adult probation. There's also pretrial. There's also the public defenders, social workers. So all of these people have their fingers in the pie, and it is difficult to know what the full number of people who have been assisted in some way prior to release is. I don't have that number. We don't have that data. I have the numbers about the touches that jail behavioral health and reentry have made to people, and that can be anywhere from a discussion of, "Hi, do you have a place to stay if you get out?" to participation in the collaborative courts, where they have to provide full-scale assessments, behavioral assessments about people who may qualify for court, for a collaborative court, and then what a recommendation would be about the court. About the placement. So it is not a number that we know. We need more data about that. What we're currently tracking in jail health, in partnership with behavioral health, in order to prioritize people exiting jail for treatment, is how long it takes for our patients who are incarcerated to access treatment beds. And we know it's much longer than it takes for someone coming from the hospital. The hospital patients have always been a priority for all sorts of reasons: acuity, cost of the bed, things like that. But we also know that people shouldn't have to stay in jail by virtue of the fact that there isn't a treatment bed available. And that's an unacceptable use of incarceration, I think, for everybody here. Next slide, Mark. And this is the flow, much less crazy, but this is a very difficult process for people who really need a very high level of psychiatric care and should not be in jail by virtue of the fact that they are seriously mentally ill, and how we go through the process of conservatorship, of incompetence to stand trial, attempt to restore competency, which involves a stay at a state hospital, return to the jail, where once competency is restored, the patient no longer has an involuntary medication order, so then they're back in jail, then they decompensate again because they're not interested in taking medication. It just goes in this infinite loop. And conservatorship is also a very difficult part of this. And in the end, even when someone is conserved, it is very difficult to find a placement, especially for people who on Murphy conservatorship, who are violent offenders. And we don't have those kinds of beds in San Francisco. So these are the challenges. And next slide, please. And just to talk a little bit separately about, because I think we know a lot about the problems with finding beds for seriously mentally ill patients and substance use beds. But then what do we have for people who don't have a place to go when they get out at 10 at night? We don't have much. It's pretty thin. We have a shelter referral. Sheriff's Department has a Nova bed if for a night or two, if someone's just awaiting a treatment bed, so they have it. It's not available the second you're getting out, but in a couple of days the bed's available, so they will help you get a bed in a hotel. There's temporary supportive housing, and not a lot of permanent supportive housing for people coming out of jail. Coordinated entry has not prioritized people exiting the criminal justice system. I mean, there aren't enough beds, period, as we all know, but this has not been a priority. And this doesn't take into account that there are other people working on this, as I mentioned, but this is why when you look at, you know, the question of why do people keep cycling back into jail? Well, one of the reasons is when they leave, they go back to the sidewalk, they go back to their tent. Many people don't want to take services as they're leaving jail. So, location can be a problem and trust around that. Many people say that the options that we provide are just like jail. So I'm not going to a shelter, that's just like jail. I'm not going to that SRO, it's just like jail. They have so many rules there. I'm not interested in that. Clearly, we are not providing the things that that people want and need in this menu currently. Next slide, Mark. This is my final slide. So we're almost through. And just to mention, we do have, with your support and thank you, a 1 FTE RN who's coming to help with discharge planning, and 4 health worker 3s who will be joining the reentry division. We are stratifying those leaving jail with additional emphasis on people experiencing homelessness and those with substance use disorders. Often those are people not really served by the collaborative courts. Yes, drug court to a degree, but many, 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 many more come in and out and have no connection with collaborative courts. Collaborative courts, the way that they work currently, they often increase the amount of time someone's in jail. So the experienced person who comes in says, no, I'm not interested in waiting for that. We have a great opportunity through the newly created Office of Coordinated Care, and Cal Aim, who has prioritized as a population of focus those exiting jail for enhanced care management. This is huge, and there is money attached to that. The implementation has been delayed, but we look forward to being able to access that. And the other thing, that support from MacArthur Foundation, another grant has been awarded to San Francisco for the Just Home Project, again, focusing on providing housing for those exiting jail or who are justice involved. And this is not something that's going to provide beds right now, but this is something that's going to help us figure out how to do that with the resources we have. Sheriff's Department, Public Defender, the DA, Adult Probation, Homeless and Supportive Housing, working in collaboration to change this. And it's just been enormously heartening to see the numbers of our city partners who are coming together with the understanding that excluding or not particularly prioritizing people exiting jail means that people continue to cycle through. This is especially important right now with the change in the DA. I expect that the jail population will increase substantially, and it already has. I know that sounds odd given the length of time the DA has been in place, but this really has to do with the number of arrests the police are making. So they were not making many arrests, as many people in the press noted, in the last probably 6 months. You know, the reasons stated or have to do with whether or not they believe the charges will be filed. The DA has, by the Board of Supervisor mandate, 48 hours to determine whether someone's charges will be upheld beyond a reasonable doubt. And if the police report doesn't have important and critical information, then the charges aren't filed. So that has changed, and we've already seen the jail population has gone up 80, a count of 80. So we've gone up about 12% just in the last 3 weeks, just while we're having another surge in the jail with COVID. and we're awaiting monkeypox. So things that really impact our ability to move people throughout the jail. So we need to really have some processes in place that will streamline exiting of people from the jail into a location that means that they're not just going to come back next week. And that is our hope. So these are our opportunities for that. I am excited that we have these opportunities, and I am also excited to take any questions that you might have right now about what we've just talked about. Thank you for your attention. Thank you, Mark.
Sure. And commissioners, thank you so much, Dr. Pratt, and for your amazing work. Commissioners, we have about 5 to 8 minutes maximum. Commissioner Gerardo, would you like me to call you? Are you, okay, hold on. and Commissioner Chung, please speak up if you'd like to, while I'm doing that, if you want to, since we're short on time.
Yeah, I just have a comment, Dr. Pratt. I thank you for painting that whole picture, and it's sadly, it's still as grim as I remember how the system was 20 years ago. Are there any
Okay. Then
are there any vaccines that are offered for the for those who are in jails for monkeypox at the moment?
We since the city just received their tranche of monkeypox vaccine, I think it was on Friday, we have been allocated, I believe, 20 doses. We don't currently have any cases of monkeypox in the jail. So the good news is that we can use those for anyone who's reported contact before they came in, and await the use of it. Typically, given the transmission risk, we would think anybody who's been in a jail cell, a cellmate with someone who has monkeypox would be targeted for post-exposure prophylaxis with a vaccine. And so far, we don't have that happening, and we haven't had anyone who's identified themselves at risk, nor has come through contact tracing from the city to say, oh, look, and this is the beauty of having one medical record and Epic. Someone at City Clinic can say, oh, look, I see that the person that you think you may have exposed is in our system, and I can contact them through the jail, and we can get vaccine available for that person.
Thank you, because it just seems like there's so many disasters ready to happen.
Yes, you're absolutely right. I mean, we see, in the initial numbers, it's, I think, about a third of monkeypox cases in California are in San Francisco. And I would say absolutely we would be a third of those will be in the jail for sure. That's the way we see a lot of STIs. A great place to treat it. Wish we didn't have to do it here. But it's a good time to get people set up for treatment.
Okay, I'm going to put Commissioner Gerardo on the phone, and she's got some background noise. But Commissioner, if you want to make any comments here or questions, here's the time. Oh no, okay. Then she asked me to pass along to you. Thanks, Dr. Pratt. She's sorry about the audio, and thanks you for your work and all that you're doing to advocate for the folks who are in jail.
My pleasure. And I think, Mark, there were a couple questions from Commissioner Green, and I wanted to make sure I answered them. The change in the DA and how that may affect the population. What services, if any, for people arrested but not incarcerated, and that is not something we do in jail health. But diversion does for people who are part of diversion. And then the number of individuals who leave jail without a secure place to stay, we don't know, but we estimate that it's somewhere between 35 and 45% of unhoused people.
Thank you, Dr. I will pass that along to Commissioner Green, and I'll be in touch with you about timing of updates, and also to make sure that that we're in touch when things happen, that you want the commission to know, even if it's not a full presentation, because I know it's important that they hear what's going on.
Thank you so much. So appreciate that, Mark.
Okay, bye-bye. Thanks. Okay, commissioners, we can move on very quickly to emerging issues. By the way, there's no one on the public comment list. Okay, there's no public comment, and then a consideration for adjournment.
Motion to adjourn?
And I'm gonna I see Commissioner Dorado, and so I take that as an action. So commissioners, I'll see you in the other room. I mean, I'll see you when I'm in there in a minute. Thank you so much.